Oxidized low-density lipoprotein, OxLDL, is a modified form of low-density lipoprotein, LDL, which is often referred to as bad cholesterol. LDL becomes oxidized when it reacts with free radicals in the body. This oxidation process alters the LDL particle, making it more harmful to your health. Here's a closer look at OxLDL, how it's formed, measured, and how one can protect themselves against its harmful effects. How is OxLDL made? Formation of LDL. LDL is a type of lipoprotein that carries cholesterol throughout the body. Oxidation process. LDL can undergo oxidative modification, especially when exposed to reactive oxygen species, ROS, or free radicals. This can happen due to various factors like smoking, pollution, high blood sugar, and inflammation. Changes in LDL. Oxidation makes LDL particles smaller, denser, and more atherogenic, capable of causing plaque formation in arteries. Measuring OxLDL blood tests. Specialized blood tests are available to measure levels of OxLDL. The Lp(PLA2), lipoprotein-associated phospholipase A2 test, is a blood test that measures the level of Lp(PLA2), an enzyme that is associated with inflammation in the arteries and atherosclerosis, the process that leads to the formation of cholesterol plaques in the blood vessels. This test is used to assess the risk of cardiovascular disease, including heart attack and stroke. Here's a detailed look at the Lp(PLA2) test. Understanding Lp(PLA2) role in the body. Lp(PLA2) is an enzyme involved in the inflammatory process within the arteries. It is believed to play a role in the development of atherosclerosis by modifying low-density lipoprotein, LDL, making it more atherogenic. Association with cardiovascular disease. High levels of Lp(PLA2) are associated with an increased risk of cardiovascular events because they reflect ongoing inflammation and instability in atherosclerotic plaques, which are more prone to rupture and cause heart attacks or strokes. What does the test measure? The Lp(PLA2) test measures the concentration of this enzyme in the blood. The result gives an indication of the level of vascular inflammation, which is a risk factor for atherosclerosis and subsequent cardiovascular events. Clinical use risk assessment. This test is often used in conjunction with other risk factors and tests to assess the risk of cardiovascular disease, especially in individuals who may have intermediate or uncertain risk. Another important lab test you can request is NMR lipo test, which will measure the particle size of LDL particle and the level of insulin resistance one has. Smaller particles, 20, are atherogenic. Treatment decisions. The results can help in making decisions about treatment strategies for reducing cardiovascular risk, such as lifestyle changes or medication. Limitations and considerations. Complementary test. It's important to note that the Lp(PLA2) test is not a standalone diagnostic tool, but rather one element of a comprehensive cardiovascular risk assessment. Interpretation. Results should be interpreted in the context of other risk factors, such as cholesterol levels, blood pressure, smoking status, and family history. Not widely used. While informative, the Lp(PLA2) test is not as commonly used as other lipid tests and may not be included in routine cardiovascular risk assessments. Markers of oxidative stress. Sometimes indirect markers of oxidative stress and inflammation are also used to infer the presence of OxLDL. Scene script. Protecting yourself. Diet. Eating a heart-healthy diet rich in antioxidants can help reduce oxidative stress and protect against the formation of OxLDL. Lifestyle changes. Making lifestyle changes such as quitting smoking, reducing exposure to pollution, and managing blood sugar levels can also help prevent the oxidation of LDL. Medical advice. It's important to consult with a healthcare professional for personalized advice on managing your cholesterol levels and reducing the risk of cardiovascular disease. Remember, understanding OxLDL and taking steps to protect yourself can contribute to better heart health and overall well-being.